Today, we're going to talk about the randomized trial of Lactin-V to prevent the recurrence of bacterial vaginosis. First, we need to define a few terms. Now we'll determine or define what is a bacterial vaginosis. Bacterial vaginosis is a type of vaginal inflammation caused by the overgrowth of the bacteria naturally found in the vagina, which upsets the natural balance. Women in the reproductive years are most likely to get the bacterial vaginosis, but it can affect women of any age. Now we watch a video that further explains this topic. Now we will define what is a randomized trial, which is the type of study that was used in this case. A randomized trial, or RCT, is a study in which people are allocated at random to receive one of several clinical interventions. One of these interventions is the standard of the comparison or control. The control may be the standard practice, a placebo, or no intervention at all. Now we'll watch a video that explains this in a better way.
A randomized trial is a way of testing new treatments without bias. Dr. Brown develops a new cancer treatment that she thinks is as good, if not better, than the current treatment. To find out if it is better, she needs to test it. The new treatment is called Treatment A, and the current treatment, Treatment B. She asks people with cancer to take part in a trial to compare the treatments, and gives one group the new treatment and the other the current treatment. To make sure there is no bias, the groups need to be as similar as possible. So, the groups need to have a similar age range of people, they need to have similar general health, and to have had similar treatments. If the two groups are too different, it might affect the results. Also, neither Dr. Brown nor the patients can choose which treatment they have. If Dr. Brown chose, she may subconsciously put the sicker patients into the current treatment group and give the new treatment to the fitter people, making the new treatment look as if it worked better when it really didn't. So to prevent bias, Dr. Brown puts the details of those taking part into a special computer program. and that randomly allocates them to either treatment A or treatment B. This means that the people taking part in the trial have treatments that are suitable for them and that will help the doctor to find out if the new treatment works better than the current one.
Now, what is a drug that we're talking about? It's Lactin-V, which is a live biotherapeutic product addressing women's health disorders. It contains Lactobacillus crepatus CTV05, a single strand of hydrogen peroxide producing vaginal lactobacillus that is a part of the natural vaginal microbiome of many healthy women. It was selected for features that restore the vaginal microbiota, prevent urogenital infections, and promote reproductive health. Now, we need to see how is this applied in medicine. Having multiple sex partners or new sex partners, doctors don't fully understand that link between sexual activity and the bacterial vaginosis, but the condition occurs more often in women who have multiple sex partners or new sex partners. Bacterial vaginosis also occurs more frequently in women who have sex with women. Natural lack of lactobacillus bacteria. If your natural vaginal environment does not produce enough of this good lactobacillus bacteria, you're more likely to develop bacterial vaginosis, therefore needing the medication to it. Now we'll need to analyze what are the pros and cons of this new drug. Being aware of the results of different investigations, we can recommend to patients different treatments according to the necessities. So if we receive a patient who has bacterial vaginosis, we can recommend this new drug so she will be treated in a better way and more efficient. On the other hand, about the cons, that new pharmaceutical treatments always cause some sort of uncertainty on the population. And being a new drug, all the necessary studies must be made in order to be able to guarantee the treatment. Now, the issue applied in Ecuador. Bacterial vaginosis tend to affect women in childbearing age. Activities such as unprotected sexual intercourse can increase a person's risks. In some cases, there are no symptoms. In other cases, there may be abnormal vaginal discharge, itching, or odor. High numbers of unprotected social intercourse are present in our country due to the lack of sexual education. Therefore, we have a lot of people that are at risk of having this problem. In conclusion, the use of Lactin-V after treatment with vaginal metronidazole resulted in significantly lower incidence of recurrence in the bacterial vaginosis, therefore having good results on the patients. Thank you.